25 minutes to 11. Thanks for your company this morning. Our talkback lines are open, 922 118 882 if you'd like to have your say. And the SMS line is 0487 999 882 if you prefer to send a text to the program. A byproduct of this pandemic, well, there's a million byproducts, but this particular byproduct is a big increase, we're told, in the demand for cosmetic surgery and cosmetic treatments, specifically here in Western Australia. The numbers have gone through the roof, according to the practitioners. But with it this morning comes a warning about one particular procedure known as Russian lips. Joining us to talk about that is Dr. Vivek Eranki, cosmetic surgeon with Cosmetic, based in here in Perth. Doctor, good morning.
Good morning, Liam.
Thanks for talking to me about this. I haven't heard of this particular procedure. Maybe you could describe it for us. Is it the same as what they used to call bee sting?
It's very similar. So basically, lip fillers is where we inject a filler into the lips. It's a very common treatment. We've seen a 3 times increase in the number of lip fillers, but one of the trends that we are seeing, especially coming in from overseas, is a technique called the Russian lip filler technique. So it basically produces lips that are a bit more pronounced with quite a bit more definition around the borders to give a bigger pout. Very, very popular among the younger patients.
See, look, I'm not a big fan of this. I understand, people want to have things done for their own personal reasons. But this whole pouting thing, I know it's very popular with selfies, especially on social media. You see a lot of it. Why do they call it Russian lips?
I think it's been made popular in Russia. I mean, previous to calling it Russian lips, we used to call it the tenting lip technique, simply in that we inject the lip filler in a vertical fashion, such similar to a pole in a tent. So given that it's been made popular in Russia, they probably just took credit for it. That's, I think, what's basically happened here.
Sure. How long does it take to do, Doctor?
It typically takes between about 15 minutes or 30 minutes to perform the treatment on a patient. And depending on the type of filler that the patient goes for, it may last up to 18 to 24 months. But there are fillers that they can have that basically are a lot more temporary than that.
It's quite a long time, isn't it?
Correct, yes.
And what's been going wrong with it?
Well, I mean, as with every medical treatment, there are risks associated with it. And in a way, what's happening is there are more and more patients wanting to undergo these procedures. So we are statistically seeing more complications coming out, and hence more complications that need to be addressed, especially in the hands of inexperienced injectors. So things that we frequently see are bruising, swelling, but in some cases we have seen infections, and other things that could potentially go wrong is any injuries to the vessels in the lips as well. But the good news here is that lip fillers themselves are reversible. So if something does go wrong, it can be dissolved instantaneously.
And what happens to the skin afterward? It just, regains its elasticity or something, hopefully?
Yeah. I mean, unless a patient's had lip fillers in there for many, many years, the skin tends to recoil quite well. I mean, skin has very good elasticity, and it does recoil once the underlying volume has gone, yes.
Have you seen some very bad results?
I have, and especially these are commonly from people who dabble in these treatments. So as in these are from practitioners who don't have a lot of experience. These are from practitioners who use subpar products. And on occasional instances, we have come across practitioners that do use products that are not TGA approved. That is always a concern. So the biggest advice I can give patients is it's important that they do their research, and it's important that they go to a reputable clinic and have the treatment done using reputable brands as well.
And how do they know it's reputable?
Yeah, that's a good question. So there are some questions that patients can ask. So, for example, when they go to the clinic, it's important to ask specific questions in terms of how many treatments the injector has performed, what is the revision rate, what is the complication rate, ask for the before and afters. If a patient is in doubt, the best body to call is the Australian College of Cosmetic Surgeons. So they're the peak body that does training for in the fields of cosmetic medicine and surgery, and they give procedure-specific training and credentialing as well. So if in doubt, that is a very good body to call.
Right, so ask the question, and if you don't get an answer, you'll know that all of a sudden there's a problem.
That is exactly right.
What sort of stuff goes into this filler? What's it made? Made from? Extracted
Yeah,
from?
from an educational point of view, the active ingredient there is called hyaluronic acid, and the hyaluronic acid is actually natural to the body. So there is nothing that is poisonous that's going in. So it is a substance that is natural, and hence it can therefore be dissolved.
So it's not an animal extract or anything.
No, it's not.
And how do they get this stuff? I mean, traditionally, if you're talking about getting it from reputable sources, where would you buy your stuff from? Does it come out of China or America or?
Oh, look, the brands that we use come out of. We only use the top brands. So the parent companies are Allergan, and Allergan basically makes everything under the sun, including breast implants. Other very reputable brands are Galderma as well, and there are smaller brands out there. I don't think any of them nowadays are made in China. However, there has been anecdotally quite a lot of patients quite a lot of practitioners who have in the past purchased products from China, either online or by visiting China, and they may be their local brands or knockoffs as well, which is why it's very important that the patients ask what brand they're having injected into them.
Yeah, that's interesting because we were talking about the increased demand overall of cosmetic procedures. One of the things they were saying, some people are having trouble, some practitioners even sourcing breast implants, for example, at the moment because the demand is so strong.
Correct. Yeah, I myself do perform quite a lot of breast implants actually, and it's all about planning. So yes, it is. It does take a little bit longer now to get the same implants, but then again, if you are well organized, you shouldn't have any such issues. We are factoring in that breast implants may take a little bit longer for them to be delivered, but again, we use the most reputable brands out there, so they do have a supply in Western Australia. So the brand that we use is called Motiva, and I believe they have a warehouse in Wembley or Osborne Park. So all the common sizes and common types of breast implants are actually kept in Western Australia, and this is why it's important to go with a reputable brand.
Okay. Thanks for taking time with us this morning. We appreciate it.
No worries at all. Have a lovely day.
Dr. Vivek Eranki, cosmetic surgeon based here in Perth. And the dangers of Russian lips. Beware the Russian lips. That's the idea today. I wonder if you've had any problems or if you've even considered having cosmetic surgery. Maybe you're on the list, the waiting list at the moment, because there are so many people wanting different procedures. According to the official figures, 92211 882 is the number. 92211 882. That apparently is a byproduct of this pandemic. Perhaps we're all spending so much time at home or on our own in the mirror or sending selfies that we're thinking, well, we'll spend a bit of that spare cash the Treasurer was talking about on improving ourselves rather than anything else. But you may have a different view on that. Don't forget, if you would like to send us an email, our address here is mornings@6pr.com.au. Mornings@6pr.com.au. Our talkback lines are open. We'll come back in a moment.